Hey, you made it! We were just talking about you today, wondering if you would come because we're all gathered together and we're ready to discuss the digestive system today. And we were hoping that you would be here, so we're so excited that you can make it. And so today, what you're going to get to do is listen to how those carbohydrates and those proteins and those lipids and all of those things are going to be broken down into small units so we can absorption. I know you're excited, so let's get started so we can get through this. But before we start, there is something that you need to kind of try to figure out. And so what we're going to ask you to do is take the Roman numeral 9 and you're going to add a symbol to make it into an even number. Pretty simple process for somebody who's a college educated person who is going to go into healthcare. And so this could be the deciding moment as to whether you find out whether you are going to pass those board exams to become a healthcare professional. If you can't do this, man, you may need some extra help in getting past those boards. So we're just saying, and so we'll reveal the answer at the end to see how close you are. Okay, digestion, basically the purpose of digestion is to reduce the large food chunks that you eat into small enough units that it can be absorbed. And the process that we're going to go through is called hydrolysis. If you remember from chemistry, condensation, or if you haven't had chemistry, basically condensation, it would be similar to thinking about condensed milk, where they take the water out of the milk and they condense it down. Well, that's basically the same thing is going to happen when you form covalent bonds. You're going to take the water out. I'm not sure why that thing comes up, but anyway, you take the water out and you're going to form covalent bonds here between structures. So that's how you would make a starch. Take sugars and make starch. You take amino acids and you make proteins. You're going to go through a condensation reaction to form those covalent bonds. What we're going to go through today is to look at hydrolysis. And if you look at the word hydrolysis, water and lysis means to break apart. And so we are going to add water back and we're going to break those covalent bonds so we can create smaller units that are going to be small enough that they're going to be able to get through the plasma membrane of our intestinal system and get into the cells and then eventually into the blood system. So that's our goal today, is to get through this. The digestive system basically starts in the mouth. And as you can see, it's just a long tube. It goes down the esophagus, goes to the stomach just makes a bigger tube, goes into the small intestines, and then goes to the large intestines, and then out the anus as we eliminate our waste. So what we're going to do is we're going to go start in the mouth. We're going to look at how digestion occurs there, and then work our way down through. This would be a good chart to keep handy. It basically has everything we're going to talk about and more. You won't be expected to know every single thing on here, but it's a good review sheet. It's a good sheet to look at, and just maybe as we go through, you can highlight things that I talk about that are important for you to remember. And so it's just another sheet that you can use to help you remember this stuff. Anyway, the main one we're going to go through is this process of digestion. We're going to work our way all the way from the mouth all the way down into the intestinal system and see how food is broken down as we go through. So this again would be something you'd maybe want to print out as a one sheet thing, and you can do that. If you look at the print options, you can print it out as one slide, as a one big sheet, and so that might be good to do to keep it handy so you can actually read it and look at that. So let's get started, and we'll start in the mouth and look at the process. As we go through, I'm going to talk about the mechanical part of digestion and the chemical part of digestion. So the mechanical part of digestion here would be obviously chewing. Now a bigger word would be mastication, but we're just going to stick with chewing. And obviously one of the goals is to break the big chunk of food you ate into a small enough size that we can swallow it. But the other more important issue might be to increase the surface area that digestive enzymes can work on. If you just eat the big chunk of food and you drink something and just swallow it down, you've got this big chunk that the enzymes are having to work from the outside and try to work their way in, where the system keeps pushing the food through the system. So it may be a possibility that food doesn't get completely digested as it gets through the system because there just wasn't enough time. If you chew it down and increase and chew one big chunk down to 100 little chunks, then the enzymes can work around those 100 little chunks and start breaking them down a little bit faster, so you get complete digestion of your food. And obviously that's going to be better to release the nutrients and that kind of thing. The chemical part of digestion is going to be mainly the saliva. And the chemicals that are in saliva, you have mucus, and the main thing is the mucins, and they are a food lubricant. They make the food a little bit slicker so it will slide down the esophagus, but it's also a cohesive. Because it will tie the food together into something called a bolus. And a bolus can mean anything that's a big amount of something. When we get into, or if you ever get into diabetes, you can sometimes give a patient a bolus of insulin. It just means a large amount of something. But actually in the back of your mouth, you have the tongue that's going to roll it together. We don't really think about it as we're eating, but kind of rolls it into a ball. Called a bolus. Okay, and it's cohesive. You know that mucus is cohesive because you remember that it kind of sticks together, because when your brother or sister got you on your back, remember, and they did the saliva thing where they let it go and then they suck it back up. But you remember that. And you know that it sticks to walls. Well, anyway. So cohesive, that would be its cohesive property. You also have lysozyme in there, which is a antibacterial. You're going to, the terminology it would use is you have a certain amount of bacteria that's going to be in your food, and then that lysozyme in the mouth is going to reduce the bacterial load of that food. It's not going to completely kill everything, but it's going to reduce the load there. So those are the main ones I want you to remember, the chemicals that happen in the mouth, and they come from saliva. The enzymes that are going to be part of the process are going to be basically amylase. Amylase is a term that means any enzyme that is going to work on starches. So obviously you can kind of imagine there's many different kinds of amylases, but in this case it's going to be enzymes that are going to hydrolyze starches. If you remember, starch is a long chain of glucose, so it's going to start breaking those glucoses down into smaller pieces. Now it's not going to completely break them down, it's going to break them down into something called dextrins, which starches can be very, very long, maybe hundreds of glucoses long. So dextrins would be breaking it down to maybe 10s or 20s, that kind of a thing. One more enzyme that really isn't active, if you will, in the stomach. It is released in the back of your tongue, because lingual always means your tongue. So lingual lipase is going to be secreted in the back of your tongue, but it's mainly going to be working on short and medium chain triglycerides, and it's really not going to become active until it gets into the stomach. So there's really no digestion of lipids in the mouth. It's mainly just going to be the starches. So we'll talk about that in a bit. But here's where the salivary glands are. There's three big ones. There's parotid, sublingual, and the submandibular. And you can tell the sublingual is when you get kind of mucus underneath your tongue. Again, lingual always refers to tongue. And you can also feel the opening of the parotid gland. Okay, right to the side of your mouth here. You can feel with your tongue about right here, you can feel a little flap that's kind of opening on both sides, and that would be the opening of your parotid gland in the side of your mouth there. But this is where the saliva is going to come from and be secreted into your mouth. And it's stimulated by chewing, secretions, but also by the vagus nerve. When you actually see food, or smell food, something will stimulate and get those processes going even before you get the food inside your mouth. So the basic final end products, the only thing you're really going to digest in the mouth is starches. You're not going to digest sugars. You're not going to digest proteins. You're not going to digest any lipids. It's basically starches, period, that are going to be broken down into dextrins and then maybe some maltose. So what this means is that the sugars, the lipids, and the proteins that you get in your food are not going to change. They're going to be the same as you ate them as when they are going to be swallowed. Maybe they'll just be a little bit more emulsified, if you will, in the mucus and that kind of thing. So as far as we're concerned, and this chart kind of shows you, is that you look at this column, it's the digestive fluid, the enzyme is going to be the amylases, they're going to break down starch, and you're going to end up with dextrins and maltose. So I do need you to remember that as we go through. And I mean, for an exam purposes, who knows, I may give you a chart and say list, what's happening here, what enzymes and stuff are available. So just be prepared for that. Okay, so the next step is to go to the esophagus, and the esophagus is going to transport foods down through, it's going to actually push the food down the esophagus through a process called peristalsis. There are no digestive fluids secreted in the esophagus. The final end products are not going to really change. Obviously you're going to continue to have the enzymes, amylases that were secreted in the mouth still working. I mean, enzymes work really fast, and so you will still have them working, but they're still going to just break down the starches that haven't been broken down into the dextrins and so forth. But peristalsis is basically just a wave-like motion of pushing, where you have contraction behind the food and then a relaxation in front of the food, and you're actually going to push the food down to the stomach. I have a little video that I will show you on peristalsis, just to, in case you don't have a perception of that, we'll give you a little visual, so hopefully this will work. So we'll go from there.
When food is swallowed, it moves down a tube called the esophagus that connects your mouth to your stomach. The esophagus lies right next to another tube, the trachea, that takes the air you breathe to your lungs. You might choke if food got into the trachea, but fortunately, the body has a safety device that usually prevents this from happening. The opening to the trachea is guarded by a flap of tissue called the epiglottis that acts like a trap door. When you swallow, the epiglottis slams shut to prevent food from going down the trachea. The journey of food through the esophagus is a short one, lasting only several seconds. But food doesn't just fall down the esophagus. In fact, even if we chose to eat and swallow upside down, food would still quickly make its way up to the stomach. The reason is that food is propelled through the esophagus, as well as the other parts of the digestive tract, by a series of muscular contractions called peristalsis. Peristalsis works a little like a tube of toothpaste. Squeezing the tube forces the paste out. Food moves through the digestive tract in much the same way. Muscles behind the food squeeze together, while muscles in front of the food relax. In this way, peristalsis forces food through the esophagus and other parts of the digestive tract.
Okay, so that ends that. So hopefully that's an understanding of peristalsis. And this happens, peristalsis is going to happen all the way through the digestive system. It just doesn't stop at the esophagus. The stomach is going to go through peristalsis, the small intestines peristalsis, and the large intestine. So that's the way food is being pushed through the system, which is why I mentioned if you don't chew your food well, the system continues to work. I mean, it's not going to wait and say, well, we've got to wait until the carbohydrates are digested before they just keep pushing. They just keep, the peristalsis happens, if you will, and it just keeps pushing the food down the system. And so if you're not digested, you're not digested. So chew your food. So then we get to the stomach. One of the reasons, not only to the peristalsis to push the food down, but it has to push it through a sphincter. And I don't know, in A&P they may call this lower esophageal sphincter the cardiac sphincter. There's kind of two names for it, but it's something that is closed because it's supposed to prevent the food from coming back up into your throat, and so it's kind of tightly through. So the peristalsis will cause it to kind of push the food to open it up, and then it will close right behind it. But that lower esophageal sphincter, or the cardiac sphincter, is supposed to prevent the acid of your stomach to coming back up into your throat, because that's what causes acid reflux and stuff. And then, so you can have that sphincter over time not be as tight anymore, or something can happen to get heartburn, if you will, or the reflux kind of thing. But the mixing, you can see that the muscles of the stomach, there's actually three, and so you have here that are called the longitudinal, and then you have the oblique layer and the circular layer, and so there's three opposing muscles that are going to work not in sync, but they work opposite of each other to cause the mixing motion. And then you can see that the inside of the stomach is not smooth, and so it's kind of like a mixture, because as you're mixing and grinding, the things that the ridges inside of the stomach are going to mix the food, so we get everything kind of mixed together. So anyway, and then at the other end you have the pyloric sphincter, which basically is going to keep everything closed in there until it's time to release it into the small intestines. So you basically create a container with the two sphincters, and then you start here, and it will go through peristalsis to push the food to the pyloric region here. So that's the mixing. The chemical part, for our purposes, there's two main things that are going to occur here. The hydrochloric acid is going to be secreted, and it does several things. It's going to get the pH down to about a pH of 1, which is very acidic, as you remember. Lemon juice is about a pH of 2, so it's 10 times more acid than lemon juice. But it's going to activate pepsin. The cells of the stomach are going to secrete an inactive form of pepsin called pepsinogen. So you might write that down, pepsinogen. And it's going to be secreted out into the stomach, and then the acidity of the stomach is going to change the pepsinogen into a pepsin, which is the active form, and pepsin is going to work on protein. Okay. From your biology, you should have learned what denature means. Denature means you break the cross linkages and you basically straighten out the proteins. And basically what that does is give easy access to the pepsin. You can imagine, because proteins have their secondary tertiaries are all curled up, it'd be very hard for the pepsin to work on there. And it makes it easier if you could denature it, open it up, and then you can have easy access to start breaking down the protein into basically polypeptides or peptides. The amylase doesn't like an acid environment, and so it likes more of a pH 7. So that pH 1 is going to basically destroy or denature, if you will, the amylase. So you will not have any carbohydrate digestion in the stomach. It will temporarily stop when it gets to the stomach. The acid is going to reduce bacterial load, but it's not going to kill all the bacteria. As you know, we sometimes get foodborne illness, but we talked about the prebiotics, the bacteria that are going to like an acid environment, the lactobacillus and the bifidobacteria. They like an acid environment, so they're going to make it through this. And then also calcium and iron, as we kind of indicated that earlier, they like an acid environment. And so the acid of the stomach is going to increase the calcium and iron absorption. Okay. One of the things I might caution you about is taking antacids. It's always kind of concerned me that people would take antacids before they eat because they're going to eat pizza or something. Oh, that's going to give me heartburn, so I'm going to take an antacid. Well, you can imagine if you neutralize the hydrochloric acid, these things are not going to happen. Okay, so you may not get complete digestion because you're not going to fully activate the pepsin. You're not going to denature the protein. You're not going to destroy the amylase. You're not going to reduce bacterial load, and you're going to reduce the absorption of calcium and iron, especially if they come from plants. Plants have a different form of calcium and iron that needs to be changed in its chemical form, like iron is in a ferric form in the plants, and it needs to be changed into a ferrous from a +3 to a +2, and that's what happens with an acid environment. So, if you take an antacid all the time just because, you may not be getting effective digestion and other things here. So I would caution against that if you possibly can. But if it hurts, it hurts. And whatever the doctor says, you do. But just to self-diagnose and take those antacids, especially the ones that decrease the amount of hydrochloric acid that's produced. So, you can have some issues with digestion. So I just bring that up for that purposes. The main enzymes are going to be pepsin. Pepsin is going to break down proteins into polypeptides. There is a gastric lipase. It seems to be more important in infant digestion than it does adult digestion, and it mainly deals with dairy products. But there is some that are produced by adults, but it's not very effective, really, and so basically it doesn't do much. So I guess for exam purposes, we're going to say that there's no lipid digestion in the stomach. Now, I did mention earlier that the lingual lipase is produced in the mouth, and it will do its job in the stomach. So you will be getting the short and medium chain triglycerides broken down, but not the long chain, which makes up most of the fat that you're going to find in food. There's also something called the intrinsic factor that's produced in the stomach that's going to actually bind with B12 in the small intestines and make it absorbable. In biology, you should have learned about receptors, and knowing that the receptors have to be the exact shape for something to fit into. Well, the intrinsic factor gives B12 the exact shape to fit into the receptor. Without the intrinsic factor, the B12 would not fit into the receptor. It wouldn't be the right shape, kind of thing. They discovered this when they were doing tube feedings, when they're doing feedings into the small intestines, and they have these formulas that are similar to Boost or some of those. I can't remember what's the one I want. Ensure. and those kind of, where everything is basically broken down. They broke it down into amino acids, broke it down to sugars, everything. It's so easy. It's just like you pre-digested everything. They knew they had B12 in the formula, but they got a B12 deficiency, which causes some issues with anemia. So you can have an anemia that is caused by a deficiency of B12 or folic acid. And so they were starting to see patients that had this anemia. And so they were wondering, well, how come? We know we got B12. We have B12 in there. Why is it a problem? Well, they found that if they bypassed the stomach, they weren't producing the intrinsic factor, so there wasn't absorption of the B12. So usually now they would give a B12 supplement. Usually have to be injected if you're bypassing the stomach, and making sure you don't get that B12 deficiency. Okay. Pernicious anemia, that's the word. I was trying to think of that, as you probably saw my eyes wandering, like I was kind of thinking pernicious anemia would be the one that would cause that. And it's a lot different than iron deficiency anemia. It's more macrocytic kind of thing. Anyway, so the final end products, when you come out of the stomach, the carbohydrates are going to be the same as what happened in the mouth, the dextrins and so forth. The disaccharides would be the maltoses. If you ate sucrose, it wouldn't be digested yet. Those kinds of things. Lipids, short and medium chain triglycerides will be broken down to glycerol, and they're 3 fatty acids, so completely digested. Long chain triglycerides are not going to be digested, and the proteins would be polypeptides. So if we look at this chart, we can see the gastric juice, which is gastric, always refers to the stomach, proteases down to polypeptides. Renin you wouldn't find except in babies. It helps them coagulate the casein of the milk that they're taking in and helps with that. So we don't have that as adults. Hydrochloric acid, not an enzyme. And the lipases, the question mark is, I mean, they are secreted, but they don't really do much in an adult. And then obviously there's no digestion of carbohydrates. So the next step is to go in from the stomach into the small intestines. Okay. I think I had a video of the stomach. Let me go back there and show that before I forgot all about that one. But let's talk. I'll show you this video.
One Life to Live and All My Children Are Back.
That's nice. I like that.
With all new episodes on Flume.com.
Skip. Sorry. Oh, these things. Let me get rid of all these things. There's another one going to pop up, I think.
As food reaches the stomach, an expandable muscular sac capable of holding from 2 to 4 liters of food and liquids, a number of things happen. Food is mechanically broken apart by the contracting, churning movements of the stomach's muscular walls. The chemical breakdown of food is initiated by the hormone gastrin, which stimulates the secretion of hydrochloric acid and pepsinogen from glands lining the walls of the stomach. Pepsinogen is an inactive form of the protein-digesting enzyme pepsin. Pepsin must be secreted in the inactive pepsinogen form in order to prevent it from digesting the cells that produce it. It is the highly acidic conditions in the stomach created by the release of hydrochloric acid that converts pepsinogen into pepsin. Once pepsinogen is converted into pepsin, it breaks proteins down into shorter amino acid chains called peptides. So the stomach itself isn't digested by hydrochloric acid and pepsin. Cells lining the stomach produce a very thick mucus that coats the stomach. However, the protection is not perfect, and cells lining the stomach must nonetheless be replaced every few days due to damage. The result of the mechanical and chemical processes in the stomach is a thick acidic liquid called chyme, consisting of partially digested food and digestive secretions. Peristaltic waves, occurring at about 20-second intervals, propel the chyme toward the small intestine. A circular ring of muscle, called the pyloric sphincter, at the base of the stomach, allows only about a teaspoon of chyme to be released into the small intestine with each wave.
Depending on the size of the meal, it takes 2 to 6 hours to empty the stomach into the small intestine.
Okay, so that's what happens in the stomach, and the 2 to 6 hours is going to be determined by how many carbohydrates or fats. Carbohydrates and proteins are broken down pretty quickly, but fats are not broken down, and they make you feel full. And we'll talk about some hormones that are also produced because of fat that actually slow the emptying of the stomach and keep the pyloric sphincter from opening. And so that's why when you eat a high-fat meal, you feel full for a long time, and you don't feel hungry. And then when you just eat carbohydrates and that, you feel hungrier sooner, kind of a thing. So that's the difference between 2 to 6 hours. Depends on the combination of carbs, lipids, and proteins that you actually eat. So we're going to go into the small intestines now, and we're going to go in as chyme. The bolus, we swallowed, and it mixed. So chyme is basically a semi-liquid fluid of 50% liquid and 50% solids. That is going to then be secreted, 1 teaspoon at a time, basically, through the pyloric sphincter into the small intestines. There is a reason for that, because it is at a pH of 1. So there has to be just a little bit of a time. I mean, if you opened it up and just let a pH of 1 go into the small intestines, the small intestines do not have the mucus to line, and so it would just burn the bejeebers out of the small intestines. And you can get duodenal ulcers. The first section of the small intestines is duodenum, so you can get duodenal ulcers because of that too. Because, glitches happen and you can let too much out. But what we'll find is that the pancreas is supposed to secrete sodium bicarbonate that's going to be a buffer that will neutralize that. So anyway, so let's go into the small intestines and look at that. The 3 main sections of small intestine, duodenum is the first section, the jejunum and the ileum are going to be those 3 sections, and depending on what nutrient it is, you will have digestion and absorption in those areas. I showed you a picture at the very beginning of the places where things are absorbed and digested, but most of it's going to happen in the first 12 inches of the duodenum. Most digestion, especially the water-soluble substance, things that can be digested very easily, are going to happen in that first 12 inches of the duodenum. So let's look at that. So we're still going to have peristalsis. It's going to be pushing about 1 centimeter a minute. So it's going to take, a little bit. We've got 22 feet to go, so about 1 centimeter a minute. It just, goes pretty slowly. The main digestive fluids are going to be sodium bicarbonate. That's going to buffer the pH 1 up to about a pH of 6 or so. A more neutral. Remember, pH 7 is neutral. And then bile is going to be a lipid emulsifier. The sodium bicarbonate is going to come from the pancreas. The bile is going to be made in the liver and secreted by the gallbladder there. I don't know if this, let me wave my hand for the light here again. I keep forgetting. It's not a very bright day out there, so let me get this. I'm back. I don't know if that makes a difference or not, but I needed a 7th inning stretch anyway, so whatever. So anyway, here the liver, the bile is going to be made in the liver, and it's going to be secreted, or it's going to be stored in the gallbladder. But you can see the progression. You can have this hepatic duct going down, and then it's joined by the cystic duct, and then it goes and enters into the duodenum here, in union with the pancreatic ducts. So that's why hepato would refer to the liver, and then pancreatic to the pancreas. So that's where they both come out the same opening. So they kind of join forces right there, and I've kind of up on the right I've shown you, here's the common bile duct and then the pancreatic duct join and are going to be secreted right into the duodenum. Now you can see where if you had a gallbladder problem, you took your gallbladder out, you could still secrete bile. It's just you don't have a big reservoir because the gallbladder is going to squeeze and push the bile out into the cystic duct and the common bile duct here, like that. So if you lost your gallbladder, you'd limit maybe the possibility of emulsifying fats. You still can because you're secreting it. It's just you don't have a big reservoir of that. Bile has cholesterol as part of its structure, and its job is to emulsify. Now, an emulsifier is something that's going to help something that's not water soluble mix with water, because it has a hydrophilic end and a hydrophobic end. The hydrophobic end, as you can see, looks very much like cholesterol, is going to bind on to the lipid piece, and then the hydrophilic end is going to be attracted to the water part of the chyme, and so it's going to allow things like the triglycerides. It's going to allow it to emulsify in water, because otherwise oil, like would float and you just have a layer on top. So you need to emulsify it so it mixes in with the chyme so it can be easily digested. Here's a kind of example. When it first gets into the small intestine, it's going to be basically a layer here. And so here's the enzyme, and if you didn't emulsify it, the enzymes would just have to work on the bottom part of this layer. But here comes bile that has the hydrophobic end that's going to basically start breaking this down into smaller units and increases the surface area so that these enzymes can work on different parts of that lipid, so it will increase the speed of digestion. So you can imagine if you lost your gallbladder, you may not have as many of the emulsifiers, the bile, so it could reduce the efficiency of breaking down fat, and you may have fatty stools. There is a name for that, fatty stools. It's called steatorrhea. It's not a pleasant thing to see, a fatty stool, but we won't go into detail. Anyway, so the fat globule, again, I'm just giving you several pictures, is going to be broken down and emulsified so it mixes with the chyme. And here's the difference. Here's oil and water without an emulsifier. You can see the oil is floating on top of the water. And then here's oil and water with an emulsifier, and you can see the oil is mixed in with the water, so it's emulsified. That's the same thing with mayonnaise. If you've ever looked at mayonnaise under a microscope, and I'm sure you probably wonder, I wish I could, you'll see little droplets of oil. I mean, it looks uniform when you look at it in a jar, but if you actually look at it with a microscope, you can see little oil droplets that have water kind of around them, and that's because they have an emulsifier, which is basically lecithin. Lecithin is an emulsifier that you find in eggs, so that's why when original mayonnaise they mixed eggs, and it's in the yolk. With that, and that's why you add eggs to anything that you would make like a cake or something where you're adding oil and water. The egg is going to be an emulsifier because the lecithin, it keeps the oil and water, or the oil and water from separating. So anyway, now they don't use eggs a lot of times in mayonnaise. They'll use an emulsifier of some kind. So anyway, so that's the bile. The other piece is going to be the pancreas, and the pancreas is going to secrete enzymes. Pancreas is a pretty important organ because not only does it produce the enzymes for digestion, but also insulin and stuff. So it's not only any organ that has tubes in it would be an exocrine gland, but anything that secretes right into the blood system without a duct would be called an endocrine gland. So the pancreas is actually an endocrine and an exocrine gland, because the enzymes and the sodium bicarbonate are going to be secreted through a duct, and then the insulin is going to be secreted right into the bloodstream. And so that's going to be the difference. I mean, they're going to be both exocrine and endocrine. But the pancreas is pretty important. It's going to produce what's called pancreatic juice, and it has all three of the different enzymes. It has lipase in it, amylase in it, protease in it. Lipases break down lipids. In this case, it's going to start working on the long-chain triglycerides. So the long-chain triglycerides do not get started digestion until the small intestines. And they actually don't finish. They start in the duodenum, but they don't finish until we get to the jejunum, because as you can imagine, first of all, they have to be emulsified, and then they're big, huge things that have to be worked on. So it takes a while, so peristalsis keeps pushing them down. By the time they're good to go and digested, they're in the jejunum. But it does start in the duodenum. Amylase, this is a different amylase, obviously, because we're down to dextrins, so it's going to start breaking down the dextrins into basically disaccharides there. And then the polypeptides that left the stomach are going to be broken down into smaller peptides, if you will. So here's the chart here, and it basically just looks at bile as being an emulsifier, and then protein or carbohydrates, the dextrins that we have are going to be broken down into maltose, and then the polypeptides to peptides. And so polypeptides, again, can be like 50 amino acids or something like that, whereas peptides are going to be like tripeptides or tetrapeptide, 3 or 4 or something like that, amino acids. And then lipases are going to break some fatty acid depending on their chain length. Long chain, if you remember, are 12 to 24 fatty acids in length. So depending on how big they are, they could be broken down into glycerol fatty acids. But, the short and medium chain are going to be glycerol fatty acids. The long chain can be broken down into mono depending on their chain length, or they may be just down to disaccharides. So it just depends on what their structure is. So let me just rephrase that, just so you know. So the short and medium chain were digested basically in the stomach, and so they're been released down into glycerol fatty acids. And in all reality, they don't need an emulsification, so they don't have any interaction really with bile. What has interaction with bile is going to be the long chain triglycerides, and depending on their structure, how long the fatty acids and what they are, whether they're saturated, poly, mono, whatever, they are going to be digested differently. And so some of them could be diglycerides, some could be mono, kind of a thing. But they're not completely digested. And so we do have intestinal juice that's secreted by the intestinal cells. And we have, again, the 3 types. And we're going to completely digest the diglycerides. If there's diglycerides there, they're going to be digested to monoglycerides. We never completely digest long-chain triglycerides into a free fatty acid or free glycerol with the free fatty acids. You're always going to end up with 2 free fatty acids cleaved off each side, and then a monoglyceride. So the diglycerides means it has 2 fatty acids left, and so one of them is going to be taken off, so you end up with a monoglyceride and the free fatty acids. Disaccharides are going to be broken down into monosaccharides, and then the peptides are going to be down into amino acids for our purposes. Now, please remember there are always exceptions to the rules, but for our purposes, that's what I'm going to expect you to remember. So the intestinal juices are produced by cells that are in what's called the crypts of Lieberkühns. And so they're going to secrete here, and they're going to just basically dissolve out here, or diffuse out here and do their work right next to the cells. and do their final digestion. So basically what's going to happen is we haven't gotten to the absorption part, but let me just give you a preview. The nutrients, because again the intestines is doing peristalsis, so the nutrients are going to get caught in these little hairs called microvilli, and also in the hairs on top of the hairs, if you will. It's like they've got split ends. These are glycocalyxes, and so the nutrients are going to get stuck there, and they're basically going to do their final digestion there, because in order to get absorbed they have to make contact with the plasma membrane where the receptors are. If you remember from biology, we have facilitated diffusion, we have active transport, and channel proteins, carrier proteins, and then we have simple diffusion. So we're going to be dealing with that with absorption, but they're going to get caught there, and then the intestinal juices are going to break them down completely. So our final end products in the small intestines, which again most of it's going to happen in the duodenum. That doesn't mean the absorption is going to happen there. This is the digestion piece only. Is we're going to end up with monosaccharides, so glucose, fructose, galactose, in as far as the carbohydrates. The lipids, the short medium chain are going to be broken. They're going to be glycerol and 3 fatty acids. And then the long chain are going to be the monoglycerides and 2 free fatty acids. Proteins would be amino acids. Okay, so that's kind of what's reflected here, is that lipases are going to break down the emulsified. And again, this is intestinal juice. Emulsified fats down into monoglycerides, proteases down to peptides, work on peptides to amino acids, disaccharides into mono. So the disaccharide aces would be like maltose, which is 2 glucoses, maltase. This is where lactase is going to break down lactose, and sucrase would break down sucrose in there. Okay. I can't remember what the next slide is, so I'll just tell you. There is no digestion in the large intestines, so we will not have any more digestion. All digestion that's going to occur happens in the small intestines. The large intestines is mainly going to be storage and absorption. So things that are not really digested in the small intestines will not get digested in the large intestines. So if you have an intestinal issue with not secreting enzymes, or if you have some kind of condition like celiac disease, or inflammatory bowel syndrome, or something that doesn't allow you to effectively digest in the small intestines, you're going to have inefficient digestion, which could mean that you're not going to break down your food into small enough units to be absorbed, so they're going to go out in your waste, which can cause some nutrient deficiencies, as you can kind of imagine. So we'll get into absorption the next time. But here's kind of a chart actually that another student made way back when, but it kind of puts everything into a package here. This might be just another option for studying, where you have kind of everything together in order to try to remember all this stuff, because we're going to add absorption piece to it, so it's going to get a little bit more complicated, but not really complicated, but just a lot of stuff to remember. So anyway, so answer to our question at the beginning: add only one symbol to the Roman numeral 9 to change it to an even number. Would be an S, and make it 6. Just saying. I don't know how many of you got this figured out, but yeah, I'm just saying. Think outside the box is the moral to this story. All right. I won't ask you what you got, but I'm sure you tried to use other Roman numeral symbols and you just couldn't figure it out. Putting another one on the other side of the X, or something goofy that doesn't exist. But this is it. All right. Groan if you want.